My name is Lisa Boss. I'm an Accelerated Ph.D. student at UT Health School of Nursing. I am the Legend Healthcare Scholar. This program has been a very fast program. It was very obvious that even though it was so fast, it was planned so well that it just flowed so smoothly. We started the program as a group of 10, and we have been together this whole time. And I think for me that has played an important role. I have felt over the past several years that had I been alone, that I probably would not have made it as far as I've come, especially in the short time frame.
My name is Leisha Cloudis, and I am the Vivian L. Smith Foundation Scholar. The biggest strength of this particular PhD program is honestly its curriculum, and this program is very focused and designed to help you succeed. As far as being in the accelerated program, there's really one word that summarizes the benefit of it, at least for me, and that's been support. Being a part of this cohort, going through this program as the 10 of us, the amount of support has been invaluable.
Hello, my name is Luba Yamin, and I am one of the Accelerated PhD scholars here at the UT Health School of Nursing. The Accelerated PhD program has been truly an amazing experience. Though the program was quite intense and some of the courses that we had to take were quite challenging, the huge advantage was that I had financial support and time to be able to determine my entire efforts to the Accelerated PhD programs.
My name is Christina Nunez. I'm a student here at UT Health School of Nursing in the Accelerated PhD program. I am the Cullen Trust for Healthcare Scholar. The cohort is really important to me as a group. It has given us the support needed in order to finish this program within the 3-year time period. Faculty are crucial in helping us get through this program.
I'm Faith Strunk. I'm the MD Anderson Scholar for the UT Health Science Center School of Nursing Accelerated Doctoral Program. Usually nurses take 8 years to finish a PhD program, and we're going to do it in 3. I would not have been able to get as far as I have without all the support I've received during this program from my faculty, from my advisor, and from the cohort of 10 of us. We have supported each other through thick and thin. We've cried with each other when things haven't gone well. We've rejoiced when things have gone well.
I'm Angela Nash, and I'm the George Foundation Scholar at UT Health School of Nursing. This program has been life-changing. I've really enjoyed it. It's enabled me to pull together all of my love of teaching and take me to a level of abstraction that I've not ever done. The George Foundation's assistance financially has made it possible for me to really focus, and I think the transition into this faculty role was made possible because of that. I don't think it would have been able to be so easy for me if I had not had the assistance of the scholarship. And it also enabled me to spend more time with the faculty. It enabled me to spend more time in my research site, and so the accelerated part was made possible.
Hi, my name is Stacy Crandall, and I am an Accelerated PhD student here at the UT Health School of Nursing. I absolutely love this program. The faculty, staff here at UT Health in Houston have been so supportive. It's great to be in a program with 9 other students. We help support each other, and this has just been a phenomenal experience.
Hello, my name is Sandy Branson. I'm one of the Accelerated Doctoral students at the UT Health School of Nursing. I'd first like to give thanks to the Hamill Foundation, who is my sponsor for this program, and also to my family and friends and fellow colleagues in the faculty of the School of Nursing. I had always intended to get my PhD, but never really had the financial capability of doing so while holding a full-time job. And with the stipend of this program, it has allowed me to commit time and dedication to my research and to finish the program in 3 years. The faculty at UT Health have been tremendously supportive, and they're very knowledgeable, very well published, and they have truly been mentors to each one of us.
My name is Anitra Frederick, and I am the Texas Children's Hospital named scholar for the Accelerated Ph.D. program here at UT Health School of Nursing. The Accelerated Ph.D. program here at UT Health School of Nursing has been, it's been very intense. I feel like because of the sponsorship, because of the ability to focus on my studies alone, I've been able to really kind of throw myself into it, and it's really been very much a gift.
Hello, my name is Suzanne Lim, and I'm a PhD accelerated student at the UT Health School of Nursing. I am the UT Health School of Nursing Advisory Council Scholar. As far as this program, I am so grateful to be a part of the Accelerated PhD program. I feel that one of the benefits of having the scholarship is to be able to solely focus on my studies. I'm very grateful to the faculty because they have been so supportive for us from the very beginning. And lastly but not least, I'd like to really thank those that have supported us, our sponsors, the school, and the dean, all of which worked so hard to make this program successful.
My dissertation research project is going to look at maternal stress, maternal-child engagement, and how that influences child health.
For my dissertation research, I will be looking at the relationship between depression and cardiovascular disease.
So my research interest involves the use of skin-to-skin contact between a mother and baby. And what this is a baby wearing a diaper only shortly after birth is placed skin-to-skin and chest-to-chest with the mother.
My actual dissertation project is going to be on symptoms in early versus long-term survivors of breast cancer who've completed primary therapy.
My research focus is human-animal interaction, and my dissertation research will involve companion dogs visiting hospitalized patients at the Methodist Hospital. Over 70% of Americans consider their companion animals to be a significant family member, and I feel like they have largely been underrepresented in their positive effects.
My focus of research is on the mother-infant relationship. Specifically, I'll be working with mothers of colicky infants. For my research study, I'm planning to teach mothers soothing strategies that she can use at home to help soothe her baby.
For my research, I will work with a group of elderly males and females who live in a retirement community here in Houston. I will measure their stress, depression, and loneliness, and then I will compare all of that data with their cognitive function. The goal of my research is to determine if any of the factors such as stress, depression, or loneliness, or the biological component affects the cognitive status of the elderly individual.
My research area of interest is in women's health, specifically on reproductive health of minorities.
My research is on adolescent development and recovery from substance abuse disorders and other psychopathology.
My research focus is to compare and determine tuberculosis outcomes for directly observed therapy here in the state of Texas. The goal of my research is to continue looking at tuberculosis disease here in Texas and some of the factors impacting its treatment outcomes. As with some of my other cohort members and fellow scholars, being faculty at a local ADN college, and saw that there was a huge lack of PhD prepared faculty. This program gave me the opportunity to attain my personal career goal as attaining a PhD, but at the same time addressing a need here in Texas.
This program has allowed me to complete all of my coursework and 2 manuscripts that I will submit for publication in the past 2 years. And I look forward to not just being able to educate more nurses, but better nurses that are able to take care of people. I want to thank the Vivian L. Smith Foundation for allowing me this opportunity.
I'm really excited about getting on board at the UT School of Nursing and joining the faculty. And I do believe that my previous educational pathway, coupled with my previous clinical experience, do put me in a good position of becoming an educator and passing on my knowledge and my expertise to the new generation of nursing students.
Upon graduation, which will be this summer, 2013, I plan to become full-time faculty here at UT Health Science Center.
When I began this program, I knew that I would learn the skills to become a successful nursing faculty at the university level. So aside from that passion for nursing education, I also found a passion for nursing research that I hope to develop over the coming years.
With this scholarship, I will be able to fulfill a dream of mine, which is to become faculty. Ever since I became a nurse, one of my goals is to receive my PhD, and with this scholarship, I'm able to fulfill this in a very timely manner and to be able to get done in 3 years, which is an added benefit. I plan to fulfill my dreams of becoming faculty, and it will be my pleasure as well as an honor and a privilege to be able to give back by serving the next generation of nurses, and I plan to look forward to that in the near future.
Lastly, my professional goals are to teach here at the UT Health School of Nursing and to continue my research with human-animal interaction and obtaining my PhD.
I'm Mara Bond. I am the head of the PhD in Nursing program here at the University of Texas Health Science Center at Houston. I have been involved in the program for a little over 10 years. About 3 years ago, we had this idea of having an accelerated PhD program because now many nurses are employed and want to go to school part-time. We recruited 10 outstanding students, and these students are the most outstanding students I've ever taught in my over 40 years of teaching college nursing students. Best part about our accelerated program is that this cohort of 10 students are very close, and they do a lot to help and mentor each other. We have a number of wonderful donors who donated scholarships for these students, and we are giving them $60,000 each year that they are in the program. There is a shortage of nurses in various places across the country. One of the problems with increasing the number of students in nursing schools is that there aren't enough faculty to teach them. And what we're doing is we are trying to put out very good, excellent teachers who can help to change that shortage of nurses by educating more students.
I'm Nancy Bergstrom, the Interim Associate Dean for Research and a faculty member in the doctoral program. It's been my privilege this last 3 years to work with our accelerated students. This is the first class of accelerated students that we had, and what a joy. So those students that were in the program full-time were able to really direct their energies, but because they made so much progress every week and because they encouraged and stimulated their classmates, the entire program was improved by having them. We have always been really grateful to the donors for setting up the accelerated program. This has made it possible for our students to not engage in full-time work, and it makes it easier for them to focus on studies. So we always remember the donors, and we're grateful to them for what they've done to help the students.
I'm Joan Ingebrigtsen, and I'm one of the faculty at UT Health School of Nursing, and I've been teaching in the PhD program, I think, since it began. One of the greatest joys for me as a faculty has been in the past to having worked very much with students, mentoring them, going through their dissertation, getting their articles published, and I am so looking forward. I can see these relationships really moving to one of real collaboration, and so we become an academic community of peers, and I think that it doesn't get better than that. And that really enriches faculty, enriches students, enriches the community, enriches the profession, and ultimately that's going to spill out to enrich patient care.